Good morning. On Friday, the FDA recommended approval of COVID-19 vaccines for children ages 5 to 11. And we're working hard to be ready to start vaccinations in that age group as soon as the CDC gives us permission to do so. It's hard to overstate the importance of this milestone in the fight against the deadly virus. Vaccinations will allow our kids to learn in a safer environment and teachers to teach in a safer classroom. And expanding eligibility will decrease community spread of the virus. In St. Louis County, community transmission among children is higher than in any other age group. The average rate of new cases is highest among 5 to 9-year-olds at 20.3 cases per 100,000 per day. And the second highest rate of cases is among 10 to 14-year-olds. The next two highest age groups are those ages 4 and under and those ages 15 to 19. Being able to provide vaccine for our children ages 5 to 11 will have a significant impact on slowing this virus. And children in this age range could be fully vaccinated by Christmas and help us keep on the right trajectory for a very promising 2022. The vaccine has now been rigorously tested among children ages 5 to 11 and proven over and over to be safe and effective. Reactions to the vaccine are generally similar to those in adults. The CDC is expected to make a final decision on the vaccine for those aged 5 to 11 this week. And if that happens, the Department of Public Health will be ready to administer the child-sized shots beginning Saturday. And here's how that will work. We will offer pediatric vaccines at all 3 of the Department of Public Health's permanent health centers at 4 library branches. And that includes holding evening hours twice a week at the South County Health Center in Sunset Hills and Saturday hours at the John C. Murphy Health Center in Berkeley. Days and hours vary at the 4 library branches we have partnered with: Lewis and Clark, Natural Bridge, Florissant Valley, and the Rock Road. We'll be able to make sure to have the details of these vaccine events posted at revivestl.com and shared on our county social media sites once the vaccine is approved. Appointments and walk-ins will both be welcome. And also, St. Louis County has partnered with a dozen pediatric care providers to supply their patients with the vaccine, and we will continue to do so for pediatric doses as we have supply. We'll be working with school districts to provide some on-site access to vaccines as well, and we'll share those details as we get them finalized. Getting your child vaccinated is the single most impactful step that parents and caregivers can take to protect our young ones from severe illness from COVID-19. For parents who have hesitations about getting your children vaccinated, I encourage you to speak with your pediatrician about your concerns and any lingering questions you may have about the vaccine. Parents who have not yet been vaccinated can get a shot at the same time you bring your child to a vaccine event. We have a patient services line to support parents and guardians with questions about vaccinating their children. And that number is 615-7967. Again, that number is 314-615-7967. And we know there's a substantial interest in getting our school-aged children vaccinated, and that's why we're planning events at multiple locations and increasing the hours of our health centers. We believe this will give us plenty of capacity. However, if we need more, we're ready to expand to accommodate demand for both the 5 to 11 age group and the continued interest in booster shots for others. And as we move into the holiday season, this is a great gift for our families to safely gather indoors and share traditions that were upended last year. Thanks, and I'd be happy to answer any questions.
Was there a need for mass vaccination sites for these booster shots? Can you speak to that?
Well, the vaccination capacity in our community is much better than it was early on in the pandemic. The question is about the need for mass vaccination sites. And we believe that our current vaccination capacity in the Department of Public Health and with expanded access through our partnership with the St. Louis County Public Library and the vaccination sites across town and doctors' offices and pharmacies will be able to manage the rush that we expect and that we have seen from boosters. We've been able to manage that. and the rush that we expect from kids in the 5 to 11 age group. It'll be a little bit tight for a week or two, but then we think all of our existing capacity in the community will be able to manage all of the interest in vaccinations.
I was also going to ask, can you speak to about the demand that you've seen at the county health department as well? We've heard of pharmacies that have been kind of really, really busy and overwhelmed. Has it been the same kind of response at the health department?
So the question is about the activity at the health department for vaccine boosters. And the activity has been brisk, but we've been able to manage the demand and meet the demand for both appointments and walk-ins. And we've been able to expand the county public health department capacity through our partnerships with the public library.
So I have a question on another topic. I'm working on a story about the standoff for the redistricting commission, which you appoint. Mm-hmm. And I understand that you don't have like unlimited latitude to appoint members. I think each party gives you 2 members or 2 mm-hmm. nominees, and then you appoint some more to the state. But it seems like 4 members were ineligible, and I want to know what happened here and why you didn't catch that when you were appointing them.
So the question is about the redistricting commission, and redistricting is a process that takes place at the local and state and federal level every 10 years. We're going through that here in St. Louis County for the county council districts. In St. Louis County, the redistricting is different than it is, every region across the country, it's a little bit different. But in St. Louis County, the redistricting commission has 7 members who are Democrats and 7 members who are Republicans, and that list comes from the Republican County Central Committee in St. Louis County and the Democratic Central Committee in St. Louis County. Each committee provided us a list of 14 members, and we chose 7 people from each list, and that's the process as it goes forwards. Where along the process did it break down? We certainly accepted the list coming from each central committee as being eligible, and the folks that were nominated by each committee, at least on the Republican side, were eligible. They only had to forfeit their other elected office in order to serve on the redistricting committee. And when they chose not to forfeit their other office, their other elected or appointed office, then they became ineligible. So they had to choose. So when we got that list, they would be eligible as long as they gave up their other job, and they chose not to do that. And that's why one of them resigned from the redistricting commission, and the other one has to make a choice, either give up the appointment or not serve on the redistricting commission.
I haven't talked with them yet. I plan to today, but I think that they're going to make the argument that since these are not county offices, like the person who's in legal fight now is on the SSD school district, which is not a county entity, that public office doesn't apply to them. How would you respond to that?
Well, that's a political argument in a political world, and the judge will make the decision. And I would expect all kinds of arguments to be made. In the end, the charter is very clear, and you might not like the language of the charter, and we've seen political interpretations of the charter to suit arguments for whatever reason. But in the end, the charter is clear, and the definition of public office is well established in case law. And in the end, the judge will make a decision. If the judge decides that this person can't serve on the redistricting commission, then we'll appoint someone else. If the judge decides that it's just fine, then we'll move forward.
One last question on this topic. You served on this commission, I think, in 2011. I think it deadlocked and went to the federal courts, which is kind of an endemic problem everywhere when you have these bipartisan commissions. Even if you didn't have this issue, wouldn't it, because the parties have different ideas about what constitutes advantageous redistricting, is it time to maybe rethink like how this commission is structured and maybe have a charter change? Because it just seems like even without this problem, it's kind of like designed to deadlock and go to judges anyways. Like, what's your thought about that?
Well, there's so many different topics in your question, mm-hmm. and most of your question is a statement, but I'll correct a couple of things. Sure. I did serve on the redistricting commission 10 years ago, and for the past 40 years, the past 3 redistricting commissions have ended up in court. Either the redistricting commission couldn't make a decision, or the decision they made was challenged in court. It goes to circuit court, it doesn't go to federal court.
Okay.
Redistricting commissions are different everywhere. Sometimes the legislative body makes the decisions, as they do in the city of St. Louis, and we're going to watch that process unfold. In state government, the state legislators choose their districts, and they choose the districts for the members of Congress as well. In county government, our charter says we have a bipartisan commission that looks at it. That's similar to what happens in other states with their state legislatures. We'll see how this process works out, and the folks in St. Louis County will decide if they want another process, then we'll have another process. This is what our charter says today, and this is the process we're going to work with.
Any other questions?
Okay, thank you.